So diving into PSA referral patterns, how have referrals from dermatologists to rheumatologists changed over the past few years? Are dermatologists referring fewer patients or holding on to them longer?
Yeah, so it's a really interesting question. I mean, I think there's been some real push, and not recently, for a number of years now, trying to get dermatologists to perform screening for psoriatic arthritis more readily. I think that has led to, I hope, some more interface with rheumatology. It's hard to really quantify referral patterns. From being on the ground, it sounds like dermatologists are trying to own the PSA screening piece a little bit more. I think the other piece of this is that many dermatologists feel like in the current era where we have so many biologic options and systemic options that also treat psoriatic arthritis, some of them are feeling more empowered to start agents that would otherwise treat the psoriatic arthritis as well, and then follow up with patients, with regard to signs and symptoms of disease at subsequent visits.
And at what point in a patient's joint disease progression do dermatologists refer to a rheumatologist?
Yeah, so this is also, unfortunately, the impression has been that it's probably later than it should be. There's some data that suggests upwards of 41% of our patients with psoriasis have undiagnosed psoriatic arthritis. So there's probably a lot floating around that never get, or certainly not in a timely manner, are diagnosed with psoriatic arthritis. So there's that piece. There's also, some understanding that a delay in diagnosis does lead to worse outcomes, including more erosion, more damage among patients who are delayed, even as a delay as brief as 6 months might lead to some more poor outcomes. And so getting patients to those, folks who are going to treat their joint disease in a timely manner is really crucial.
It's interesting that you said that, and you touched a little bit on the timing aspect. So when you're putting your rheumatologist hat on, do you feel that dermatologists are referring patients with that concomitant psoriatic arthritis in an appropriate time frame, or what does that look like from that perspective?
Well, the problem for us is we don't necessarily know. If it's really hard to truly quantify referral patterns. I mean, I think, there's what you all have in your data, what dermatologists report. I think, there are, again, hints that maybe it's not happening as readily or as frequently as we would like in the community, based on some of those quotes, like the fact that 40% of psoriasis patients seem to be going around undiagnosed. So it would suggest that there's still a gap and an unmet need there, and that patients, probably could be screened more regularly, more aggressively.
All right. So, I mean, that makes sense. And I guess if we're thinking about it, let's step back a few years and look at that co-management pattern 5, even 10 years ago to what it is now. How has that evolved over time? What did it look like then, and what does it look like now?
So the co-management piece, I think, is an important one. It is, again, I'd like to think that we are seeing increasingly some collaboration between dermatologists and rheumatologists, even if it's through just facilitated communication, that through the EMR, through good old-fashioned pathways like picking up the phone, there are more connections made around the psoriatic arthritis piece, and therefore more patients getting to drug. There's been some data suggesting that those collaborations do lead to a more timely transition to systemic agents. So there is support for that. At the same time, it's a bit hard to quantify how the practice patterns have changed in the real world as such.
Okay. And I know it's interesting from your perspective, given that you have both hats. You have that dermatology arm, and then you have that rheumatology arm. So I guess thinking past your own perspective and thinking about your dermatology colleagues versus your rheumatology colleagues, do they feel that co-management is in a good place right now? Do they feel that there's room for growth and room for expansion in that relationship? What does that look like?
Yeah, it's interesting. I think both parties probably feel that there is often a delay, depending on where one lives, particularly in the US, a delay in ability to get patients in with the other specialty. So that can sometimes be a little bit of a barrier. It's a barrier we'd like to see, lowered over time. I think in general, the dermatologists are more than willing to share that decision-making process, with rheumatologists, and have the rheumatologists really make the diagnosis and drive the treatment plans around psoriatic arthritis. On the flip side, I think the rheumatologists tend to undervalue to some degree the impact of the skin disease on quality of life and on more treating to target and owning that skin treatment piece. So I think there are gaps on both sides. Frankly, it'd be nice to see, again, more of these partnerships and even formalized partnerships to get patients to the right therapy. But I think there are still some barriers to doing that, particularly in the private practice and community setting.
Mm-hmm. And, even thinking back to our recent patient chart audit that Gianna and I ran for psoriatic arthritis with those two different arms in mind, we saw that the drivers for picking those treatments, like from a dermatologist perspective, what Gianna, it's mostly they're thinking more about that skin involvement. And then when we look at the rheumatologist, they're looking more so at that joint involvement. Still, both of them keep in mind their respective counterparts with the joint involvement for derms and the skin for rheumatologists, but definitely there is a more of a heavy weight for joint for rheumatologists and vice versa for the derms. So definitely seeing the same sort of themes there.